It is my pleasure to introduce Dr. Leo Morales, the Director of the University of Washington Office of Health Equity. At this time, would you join me, everyone, in welcoming Dr. Leo Morales?
Thank you, and hello. My name is Leo Morales, and I'll introduce a little bit about myself. I'm a general internist. I'm a health services researcher, and I serve as an assistant dean in the Office for Healthcare Equity. And also I co-direct a center called the Center for Latino Health. I'm a native of Seattle. My family is from La Paz, Bolivia. And I grew up as in an immigrant family, speaking Spanish before English, and by no means was I in my mind that I would become a physician or be speaking to you today in this role. So I've shared some of this journey, and so I'm happy to be here and help this conversation move forward. So today, I'm going to share with you the results of a report that we produced through the Center for Latino Health. And so I'm going to share my slides. I think I need someone to make me a co-host. Okay. Thank you. So the title of our report is Today's Changes for Serving Tomorrow's Diverse Communities, Increasing the Latino Physician Workforce Now. This report is focused on Latino communities and the Latino physician workforce in our state, but I think many of the things I'm going to say apply to other communities as well that are underrepresented in our state. So I wanted to start by sharing with you the members of our team. We had a fantastic team, and I think the things I appreciated most about this team are, one, we're interdisciplinary. So we had faculty from the School of Medicine, myself, from public health, from social work, from education, and as well as others. And the other thing to note is the majority of us are Latino. So we were Latinos working together to help address this problem. And I think in my experience in higher education, this is a relatively rare phenomenon. So the work of this project is not only to produce a report and data, but also to help mentor and bring experience to other young Latino faculty and staff who are interested in engaging in this kind of work. Our project was sponsored by the state legislature through a state proviso, sponsored by Representative Javier Valdez and Senator Emily Randall. So the goals of our report really were to, unlike many reports which are intended to produce some data, write a report, we really wanted to see this report be a vehicle for policy change. And I think this kind of research is more aimed at providing evidence and then and moving it into the policy arena. So we wanted to both inform, but also make policy change for the state looking forward. In order to do that, we decided it would be important to form a project advisory board early on in the project that continued to meet throughout the project and became our sponsors and advocates for policy changes we wanted to bring about. And if you take a look at this list of people, you'll see that they are from multiple sectors and from multiple institutions. So we had folks from Kaiser, we had representatives from Washington State Medical School, from PNWU, which is the osteopathic school. We had people, elected officials, and we had folks from organized medicine. So WISMA, the Washington State Medical Association, as well as other higher education institutions like Western Washington. So a really diverse group that remained engaged and supportive throughout this project. So why is this an important issue? I think COVID has unfortunately provided us with a lens to really understand the impact of having a health system that doesn't serve all our communities well. In the case of Latinos, you know, at some point as high as 40% of cases have been among Latinos in our state, even though they're only 13% of the population. And they suffer four times the risk of infection and also 4 times the risk of death due to COVID in our state. If we try to understand why, part of the answer is limited access to culturally and linguistically responsive healthcare. So how do we know that this is the case? Research shows that linguistic and cultural concordance, that means sharing a cultural and linguistic background with patients, between providers and patients, results in better healthcare for patients with limited English proficiency. And that physicians from these communities are much more likely to practice in underserved communities. So we get better healthcare, and we get healthcare where we need it when we have a more diverse workforce. So this study is based on data from the Washington Medical Commission Physician Survey. It only includes graduates with MD degrees. So due to the vagaries of the state licensing procedure, MDs are licensed separately from DOs, although that's changing. And it does not include resident physicians, physicians applying for an initial license, and it does not include physician's assistants or nurse practitioners. DOs are not included because they're, as I mentioned, included under a separate system. So it's limited, but it gives us a good idea of what's going on in our state. So we had approximately 14,500 physicians who remained eligible after excluding those who were not practicing or not practicing in our state. And what we found is that currently about 3% of the physician workforce in the state of Washington self-identifies as Latino. That rounds out to a population ratio of about 45 Latino physicians per 100,000 Latino population. Compare that with the representation of non-Hispanic white physicians, which is about 277 per 100,000 in our state. Only about 11% of current practicing Latino physicians in the state were educated in our medical schools. That means the vast majority of Latino physicians currently practicing here are either trained in other states or territories of the United States or foreign medical graduates. And parenthetically, that 11% really only represents graduates of UW Medical School, because we did not include PNWU graduates, and Wazoo has not had a school long enough for them to be represented in this data. So what do Latino physicians bring in terms of language access? 75% of Latino physicians report speaking Spanish well enough to provide care in Spanish, compared with about 13% of non-Latino physicians. And I think it's important to also note that 24% of those Latino physicians who report speaking Spanish well enough are foreign medical grads. Latino physicians serve patients from lower income groups, including those who report receiving Medicaid and Apple Health, about 40%. And now I'm just going to show you a little bit of geography of our state to help explain the following slides. So this is this shows you the concentration of Latinos if you count them by number in our state. And you can see the counties on the west side here, with the exception of Yakima County, are really where the greatest numbers of Latinos are located in our state. But when you look at the Latino population in terms of percentage wise, in other words, the highest concentration, it's really Central Washington. So Okanagan, Chelan, and on so on going south. In particular here, Yakima County. So there is this interesting duality to our community, rural and urban. So for our report, we mapped where Latino physicians are located. These dots represent individual doctors and where they practice. But also here you can see their representation relative to the state population or the county population. So these lighter areas that represent lower proportion per 100,000 population are states that are really underserved. And so many of these counties where we saw the highest proportion of Latino physicians are actually underserved in terms of having enough Latino physicians in those areas. The vast majority of Latino physicians are located on the west side, where we see the greatest numbers of Latino patients. But these other areas, these rural areas, are highly underserved in terms of Latino physicians. And just to give you a sense of the relationship to COVID, we know that Central Washington has had disproportionately high rates of COVID. At one point, Yakima had the highest rate of COVID on the entire West Coast. And that county is 50% Latino. So what do we need to do in terms of reaching parity here? So we have about 462 Latino physicians in our state. If we were to reach parity with non-Hispanic whites, we would need to add 1,885 Latino physicians tomorrow. That's what it would take to bring parity. So that's really impossible. So, just to give you a sense of where we are, if we look forward, in order to maintain the same ratio of 45 per 100,000 physicians, we need to add 64 every 5 years, more or less. And we would be needing to add on the order of 260 every 5 years if we were to reach the similar proportion and maintain parity with the growing Latino population in our state. So the thing here is we're falling behind. The total number of Latino medical students enrolled in our schools is about 143, or about 7.3% of the state's medical students. At this rate, the representation of Latino physicians will decline over time due to the projected growth of the Latino population. So we're not keeping up. And nationally, we're competing for these graduates. We need to grow the pool of applicants. I'm going to very quickly go through this. These are the recommendations that came from our report. We were successful in integrating some of this work into policy. So we had SB 5228, which is currently on the floor for a vote, which would set a goal for population parity and a requirement for reporting. We also integrated one of our recommendations into House Bill 1129, which was to create a pathway for international medical graduates to enter Washington residency programs. And again, this is working its way through the legislative process currently. We had other policy recommendations regarding the strengthening of the pre-medical ecosystem. Again, we're not really going to change this equation until we really increase the number of well-prepared Latino students that are well-prepared for medical school. We also need to increase admissions to medical school, and we need to help with financial support. There's other ideas about leveraging the existing URM workforce, that is creating additional pathways to medical care, not just through the traditional 4-year medical college education to medical school, but through a route that includes work. We had a recommendation to create a statewide Latino physician organization, and actually that has happened. WISMA stepped up and we have created that organization. And we need to do more of this kind of work that links research and policy. So our ongoing and future directions are for this legislative session, we have a policy work group that is working to pass the initiatives I shared. We're going to form another policy work group to work on new goals for the 21-22 legislative cycle. We're going to augment the Medical Commission survey of physicians with information about diversity and cultural competency of the physicians in our state. We have a faculty affiliates program focusing on Latino health. And finally, we are offering students mentorship and support through our center. Again, being engaged with the kind of work we're doing, both on policy and right now, very much so on COVID. So with that, I want to thank you. And, we dedicated this study to the future Latino physicians of our state and the communities that they will serve. I'm happy to answer any questions, or please feel free to reach out to us. Gino Eisenberg is my co-director for the center and a faculty member in the School of Social Work. Thank you very much.
Let's give Dr. Morales a round of applause, everyone. Dr. Morales, we have a question for you. Were there nursing schools or organizations involved?
So, this was a very focused project. It really only focused on physicians, but we recognize, and actually one of the outcomes of this work has been interest by other schools in the health sciences. And they are facing similar issues in terms of diversity. So whether it's nursing, public health, pharmacy, social work, nursing, these are the same issues. And it's a desperate situation. I mean, our population is becoming diverse much faster than the health professions. We're falling behind. We're not keeping up. And we have a ways to go to make up, to even get close to having our workforce look like the patients we serve. I think I'll just say one other thing. I think COVID has shown me that it is so important that we have diversity in our workforce. We are really failing our communities of color in this state in terms of, testing and now vaccinating. And I think a large part of it is the disconnect between our healthcare system and communities.
Thank you so much, Dr. Morales. Dr. Morales, can we give a round of applause once again to Dr. Morales?